I'd like to introduce Seth Merritt from Portland in Oregon. Seth is a nurse practitioner who prescribes LDN. Thank you for joining me, Seth.
Hi.
Now, you were telling me that you had taken LDN for psoriasis. Could you tell us about that, please?
Yeah, I have had psoriasis for about 10 years now, and I, about a year and a half ago or 2 years ago, started learning about Low Dose Naltrexone, and after I had kind of looked and actually gotten on your website and had looked through some patient forums and listened to all the content that you had posted, I decided that maybe that would be an interesting thing to try for myself. And yeah, so I've been taking that for about a year at this point, and kind of been prescribing it for about a year and a half or so.
So how was your psoriasis when you started, and what's it like today?
It was a little bit worse than it is now, which is nice because I don't generally have to use any other kind of meds for it. So I don't have to use any kind of steroid creams or anything else, which I was using a little bit more frequently. So so that's been nice, is just to kind of have less frequent use of other medications to control it.
Mm-hmm. And when you first started, what dose did you start on?
Well, I was using a cream called the Low Dose Naltrexone. Yeah, yes. I did ramp up from 1.5 milligrams, and then I've just kind of did about 5 days of 1.5, and the 3 milligrams for about 5 days, and then I just stayed at 4.5 about 5 days later. So.
Mm-hmm. Did you notice any side effects when you started?
Just a vivid dream. I remember that I started it towards the evening, had a few kind of vivid dreams, so I backed off and started taking it during the day. But then, my body's been pretty used to it at this point, and I do take it at night and now, and not really have any problems with it. But it wasn't something that was super disturbing, and I haven't really had any other side effects. I've had some other side benefits though, where used to suffer from shin splints quite often that would keep me from playing sports like I like to do, and that's actually gone away. And it's hard to know if to contribute to LDN or not, but it did go away right around the time that I did start it. So that's another hesitation for me to stop it, because I have been able to tolerate playing so much more that it's been really nice. So that's been kind of the side benefit that I've been experiencing.
Mm-hmm. And could you tell us what conditions you've prescribed LDN for?
Yeah, it's there's quite a lot of kind of across the board conditions that I've used it for with patients, just from something really very generic, just like people they have a lot of inflammatory symptoms, like they have joint pain, all over the body. They have, certain abdominal pain and stuff. I'll use LDN for that. I have quite a lot of patients on fibromyalgia that take LDN, and was able to get about 3/4 of my chronic pain patients that were taking opioids off their opioids, and now just do low-dose naltrexone. So some patients were taking methadone, some patients were taking up to 100 milligrams of MS cotton 3 times a day, which is a very high dose. And after we kind of went down fairly slowly and had them without opioids for about a week, we introduced low-dose naltrexone, and their pain's been better than it was ever on all the opioid medications they were on. So that's been very helpful. I have used it for fertility purposes in some patients, and have had pretty good success with that. I've had I have one person with Parkinson's on it. I have a couple people with MS on it, some polymyalgia rheumatica or PMR. I've been using it more for diabetes, actually, type 2, and am noticing a good % or so drop in A1Cs, and been kind of helpful and instrumental with me getting patients off their insulin if they're type 2 and on insulin to reduce their insulin so they're able to lose weight, actually, because insulin is a big weight gaining medication. So I actually do a lot with dietary and weight management stuff with patients, which is kind of my subspecialty, and that's how I actually learned about naltrexone to begin with. Is that there was a new medication coming out called Contrave that I wanted to learn more about, because I knew they had a naltrexone and Wellbutrin in it. Wellbutrin's an antidepressant, and the naltrexone part, I just started learning about, well, what's that doing there, and how would that help someone lose weight, and then realized that it blocks cravings in people and in higher dosages than low dose naltrexone. But then I started learning more about it, and I ended up finding out these low dosages which help with fibromyalgia, and kind of did some research and actually found your website, and to where I learned a lot through watching all those the provider interviews that you've done with the medical providers, and it's been great ever since. So thank you for your website, by the way.
You're welcome. So from your patients, if you had to say, because these are questions that I'm asked all the time, if you had to say a point where you thought the patient would notice some benefits of LDN, as in how long would you say it would take before a patient on average would find that LDN was working?
Yeah, it depends on the underlying cause, I would say. So the patients that have kind of pain and inflammation related to pain, I think are going to notice benefits more right away after they start that 3 milligram dose. So usually we start at 1.5 milligrams, ramp them up to 3, and then to 4.5. And generally people don't feel anything at 1.5 milligrams. But the patients that have maybe kind of hormone imbalance, maybe due to inflammation or the diabetes or the infertility issues, well, they might kind of take a couple weeks to end up seeing that blood sugars are going lower, or of course with infertility you got to kind of wait till they cycle to notice if there's anything that's been changing. It has been helpful with menstrual headaches, by the way. That's been something that's been nice. And yeah, so it kind of depends on the underlying process, but it doesn't take months usually to notice any difference. And the only people that I am cautious about it with, not that I wouldn't prescribe it for, just that I've had people that have some kind of side effect from it, generally are the people that have or are already on thyroid medication, because generally what I've noticed, and I think that it's been a kind of consensus of other medical providers, is that you can help their thyroid function so much, possibly with LDN, that you need to reduce their thyroid dose, or else they might feel like they're now a little, maybe a little hyperthyroid, or there seems to be some kind of little interaction where people feel a little off, little headache, stomach pain, and a little irritability, and that's just a good sign for me to take down the thyroid medication, actually, and generally those symptoms do improve. So
yes, that's what I've been told as well. So that's really interesting, and I think if people are taking a vast cocktail of drugs, to be able to actually come off a lot of your drugs or lower certain drugs, it's got to be better for your body, isn't it, rather than filling it full of medications.
Oh, yeah. Absolutely.
So I just wanted to ask, have any of your patients reported back to you any unusual side effects?
I had a couple limited cases that like two that came to mind. One, we don't really know if it was this or not, but it seemed like with people that may have a little underlying, like, sluggish liver problems, that maybe their liver's not clearing the naltrexone very well. My theory is that it must stack up and circulate at higher dosages if you're not clearing it, and therefore you're going to get side effects of the higher dosages of naltrexone. And the two things that happened in both cases that I'm referring to, people got depressed. And that seems to be the side effect of the higher 50 milligram to 150 milligram dosages that they'll use for opiate and alcohol kind of problems. But the one patient had porphyria, and which porphyria is really the inability to process most anything through the liver. It seems to be problematic, and this patient actually was using naltrexone as a cream. So the loss of pleasurable experiences and depression kind of happened with her. We had to take her off of it, and it did get better. So it was really, really weird. That's a rarity, but that was an interesting kind of case that did happen. Another person that had interstitial cystitis, a male, he felt like there might have been some depression, and we chose to take him off that. But he was also a very stressful job, so it's kind of hard to really tease that out of if that was the case or not. But the other person